Welcome back. Record 1.2 million people are living with HIV in the United States today, and more than 35,000 new HIV infections are reported annually. So to help talk about that and bring awareness to the issue, today is National Women and Girls HIV/AIDS Awareness Day, and I'm here with Dr. Leslie Cockerham, Vice President of Medical Affairs at Vivent Health. Great to see you, Leslie.
Thank you very much.
Let's talk a little bit about, can you just kind of give us a status update of where we are in this decades-long battle of HIV and AIDS?
Well, as you said, you know, the epidemic is ongoing. We're still seeing new infections every year, and as you said, we've got a record number of HIV infections. But we also have all the tools that we need to prevent HIV infection and to really stem this epidemic. We know that we've got medications such as pre-exposure prophylaxis, a pill people can take once a day to prevent HIV. And we know that if we can keep people in care and on their medications, then they don't spread HIV and they can live long, healthy lives.
You know, I wonder if some of the progress that we've made there, which is very positive, has also hurt your message as you try to get people to take preventative measures. Are you seeing a little of that, like we sort of let our guard down?
Yeah, I mean, I think you're right. On one hand, HIV is not at all the death sentence it was back in the 80s, which is great. And it is easy to let your guard down. But at the same time, again, there's a lot of people out there who don't know that they have HIV and that are still dying from it.
Let's talk specifically about the demographic of women and girls. What concerns you most about that population as we wage this continuing battle? Yeah,
we are seeing a decrease in the number of HIV infections in women and girls overall. But we still know that African American and Latino women are disproportionately affected when compared to their other counterparts. And we still know we've got some work to do in that area.
And how do we do that work? What do you recommend? Like, I'm a parent of young girls specifically, and one's in high school, one's in middle school. When do we start having those conversations with our kids about this?
I mean, early on. I'm already talking about it with my kids. You know, I think part of it is just talking about it, normalizing it, taking away that stigma of it, and then starting to let people know again about what they can do to prevent HIV. That might be, again, using condoms, using PrEP, staying in care, getting tested. That's another big issue. 1 in 8 people don't know they have HIV. And so we really need people to just get out there and get tested.
I know you've got good resources online as well if people want to know, how do I even begin to start having those conversations?
Yes, so the CDC websites, you know, HIV.gov, they're always a great place to start and talk a lot about HIV basics and where to get care and where to get testing. At Vivent Health, we have a website you can see. We provide care for anybody regardless of their ability to pay here in Milwaukee and other places in Wisconsin.
That's good news. Dr. Cockerham, thanks so much for sharing that with us today on this important day. And you can find more information on our website. She mentioned that it's up on the link right now. We took care of it for you. Just head to the link section of tmj4.com.